We feel that cystic fibrosis is a really important exemplar of how healthcare technology may change care for lots of different conditions going forward. And CF is particularly important because generally it's young people who are tech savvy, who are interested in technology, who have a lifelong condition. So essentially smart care is home monitoring, remote monitoring, it's empowerment, giving people with CF the tools to monitor themselves.
Since doing my daily monitoring, I've actually become a lot more healthy. I found that, like you say, monitoring things, I've been able to keep an eye on certain things and where necessarily I wouldn't have noticed before. It syncs to the scales. Daily I monitor different aspects of my health using different pieces of equipment. I've had a pulsometer that I just put on my finger. The next one we do is the lung function. Wellness, to say how you're feeling, and then you have your weight, which then syncs to the scales. That's done.
The success of CF care means that a lot more people with CF are alive today than there has ever been before. And that's obviously a fantastic thing, but it does mean that there's an increasing pressure on the services that exist. And in the current climate in the NHS, getting additional resources for CF care is a challenge. So we feel not only is smart care beneficial for people with CF, in the sense that they can stay at home, receive treatment at home, monitor themselves at home, but it's also a benefit to the NHS because it's a way of the NHS dealing with the increasing numbers of people with CF.
Currently I go every 6 weeks, which hopefully, using the equipment, I won't need that. I'll be able to, they'll be able to monitor from their end, I can monitor from my end, and the communication can obviously then be the fact that, bar the fact I need my port flushed, which I can get done locally, I won't need to drive an hour every 6 weeks to get to clinic. Literally, it takes 5 minutes, 5 minutes of your day. 5 minutes of your day would stop you having to I'm lucky I go 6 weekly, people go 2 weekly to, clinic appointments. My hospital's an hour up the road each direction. It's a case of, you've got to be, you're not working because your health's bad. You then can't afford the petrol to get there. Being able to, upload a few things to an app, you're gaining so much more. And the fact you can monitor yourself, you can monitor the fact, that you're losing weight. Actually, do you know what? You need to eat a bit more. Your lung function's dropped a bit. Oh, maybe I can exercise a little bit more this week. And just by doing those few little extra things, it makes a hell of a difference, it really does.